It's the Wow Show, Women on Women. I'm Shazmin Shamsuddin.
I'm Joanne Campopo.
And Ning's not with us because she's too busy being a superstar.
That's right. We are rooting for her though.
Yes, we are. And today we're delighted to have Dr. Kenneth Kok, who is a consultant in plastic, reconstructive, and cosmetic surgery. With us is Dr. Melissa Tan, who's a consultant breast surgeon who specializes in oncoplastic breast surgery. Welcome to the Wow Show.
Thank you for having us both.
Thank you, Shaz and
Joanne.
Well, you guys are a husband and wife duo, yeah? And I understand that breasts brought you both together.
So, when did this breast meet? How did they all get together actually?
It's quite an interesting story. So, obviously both doctors. We actually left Malaysia back in the 1990s to go to the UK to study. And then, life happened and we carried on being there. So we were there for 28 years.
Wow.
We only came back to Malaysia about a year and a half ago. But to cut a long story short, I was on call for the plastic surgery department in a hospital in the UK. And Melissa, my wife, was the ED doctor at the time. So she'd often refer cases to me, and I got quite annoyed because all I wanted to do was stay in theatre, but I was called out by her to go to the ED department.
Aha.
So that's how we met, really.
I see.
Wonderful. Was it love at first sight though?
Well, I think the trigger point is he got irritated that she gave him all the cases. So it's like, okay, I need to see this woman, who is like taking into my theatre timing. And when I mean theatre, of course, we are talking about the surgical theatre. You're not exactly like a Broadway singer or anything, right?
No.
Doctors series that I watch, like Grey's Anatomy, New Amsterdam, The Resident, are all the doctors like that?
Of course.
I think
100%, Joanne.
I think it's more probably like my case, like, who's this tall, good-looking Malaysian boy here who's always not saying hello to me? It's like, what do I need to do here? Okay, done.
So that's why you're getting all those cases.
Yes.
Just like, who is this tall, good? Okay, let's give him more.
Pecah. Okay, well, today we're actually talking about getting your best breasts after breast cancer and surgery. I don't know how many of you know this, but I am a cancer survivor, breast cancer stage 1, and I have had to have had a lumpectomy. So I've undergone all that, but for the benefit of our listeners, this is a journey that is full of, I guess, anxious thoughts and some grieving as well, yeah?
Yes.
So could you share on your perspective, like what typically goes through a patient's mind when told that they need to get a mastectomy or a lumpectomy?
Yeah, so Shaz, you've said it. Patients often go through stages of grief. It's no different from losing someone or going through a marriage breakdown or a divorce.
Yeah.
The stages of grief are like shock, fear, denial, anger, anxiety, even bargaining or depression. And hopefully towards the end, we'll come to a point where we all accept the diagnosis and move forward to understanding the different type of treatment options. So yes, it's not like a snapshot. It can just come back after 5 years, 10 years, 20 years. It's truly a life-changing diagnosis.
Right. And how do you approach that initial conversation when you have to break the news?
Yes. So obviously it's a difficult time. I need to approach this with care and empathy. I truly believe that education is power. I tend to offer as much information as I can according to patients' needs so that they feel empowered to make the right decision for their treatment plan and also have the confidence that these are all evidence-based treatment options. So That way we can walk through this journey together, because there's no longer one size fit all. And one person in the other room may have had this treatment, but it's not always the same. So a multidisciplinary team approach of offering them evidence-based with their loved ones or trusted loved ones in the clinic often helps, because they usually go home and all they hear is the C word. I'm going to die. I'm going to lose my breast. So
there's a lot of fear and confusion as well.
Yes. And having someone with them, well, hang on a minute, Dr. Mel mentioned this.
Correct.
So I often also provide them with information, written information. I draw pictures and they would want to take them all with them and refer back. And I always tell them, you don't need to make decision now. Just come back. Just come back with more questions. But probably not too much Googling. I'd rather you ask me than Google all the big C's.
I'm so good at Googling everything. You know?
Yeah, you've had every sickness on the planet, right?
Here I am. I mean, like, speaking of the choices as well, what are the different surgical options available for breast reconstruction after cancer?
Yeah, I mean it's a very heavy question actually, because there's so many options, right? But generally speaking, if you look at breast cancer treatment, you can divide them into two main topics, right? It's either going to be a lumpectomy or breast conserving surgery as we understand it, or a mastectomy, right? It's going to be one or the other. So your reconstruction options really depend on what the team decides that is the best treatment for you. So, Melissa was very fortunate to have, obviously we both trained in the UK for many years. She was very fortunate to work in some of the top hospitals in the UK. And breast conserving surgery reconstruction options have actually advanced very much in the last 10, 20 years, right? So I was going to pass over to Mel just to talk about some of those options for the local sort of lumpectomy.
Okay, what do we have locally?
Yeah, so I'll talk about the lumpectomy options and Dr. Ken will talk about the mastectomy and reconstruction options. So traditionally, when patients have a breast cancer lump, and if it's surgeon would just remove the lump and close the wound, occasionally can result in breast disfigurement, a breast that's not cosmetically accepted, a breast that is constantly reminding patient that how ugly I look like, perhaps. So I've been very fortunate to be trained by some of the well-known surgeons in the world in 3 different cancer units, like the Royal Marsden Hospital in London, the Breast Cancer Institute in Nottingham, and the Breast Centre in Birmingham, whereby now we have techniques, so-called oncoplastical surgical techniques, oncoplastic breast surgery technique, where we are able to remove bigger breast lumps and fill the space with partial breast reconstruction techniques. And this leaving patient with hidden scars and cosmetically acceptable breasts. That's not only safe, but result in better quality of life for our ladies.
For them as well, they feel like more, I guess, it's already such a traumatic experience.
Yeah.
Yes.
Having that. And yes, being a woman, we want to still have that womanly figure. Or,
exactly. Can I just interject before you move on to the rest of the techniques? If someone has had the lumpectomy like 5 years ago and they're not happy with the result, is it too late to get it redone?
Yeah, I was going to ask that. I'm like, okay, what if one is square, one is round, and I want both to be round?
Yeah. Well, I think then you need to come and see me, right?
Well, there you have it, friends. You need to go and see Dr. Kenneth.
But let's come back to you quite rightly say it's never too late.
It's never too late.
It's never too late. There are so many techniques, so many techniques that we use both in breast surgery and plastic surgery that are available, but may not be in the sort of mind of the patient, because the first thing the patient wants is, I want this cancer out.
Yeah, that
was
the
that was the
situation
first
for
thing.
me. Yeah,
Just get it out.
I don't care what it looks like.
Yeah,
Just out.
that's right. But then years down the line, you might look at it and think, I'm a cancer survivor. Why can't I look better.
I deserve good
You
Yes.
boobs.
deserve, right,
Yes.
right.
Yes, exactly. We all deserve good boobs.
Yes.
I agree, actually.
Yeah.
Well, here's the thing. Like, can you explain like the pros and the cons, especially for implant-based reconstruction?
Yeah.
And then there's also autologous. I don't know if
Autologous.
I'm saying this correct. I mean, you use your patient's own tissue to reconstruct
That's
their
right.
breast, right? So among these two,
Okay.
what are the pros and cons?
Let's take one step back.
Okay.
And let's just talk about the sort of mastectomy reconstruction, because it kind of
Okay.
answers the question you've got about the
Okay.
pros and cons. Essentially, if you think about it, the breast consists of skin and soft tissue and volume, breast volume.
correct.
So if you have a mastectomy, there's basically two types of mastectomy you can have. You can either have a skin-sparing mastectomy, where the skin envelope is maintained
Mm-hmm.
and you only remove the breast tissue, or you remove skin and breast tissue. So the kind of reconstruction that we do really depends on what we're trying to replace. If we're just removing the breast tissue and leaving the skin behind, then an implant-based reconstruction into that soft tissue envelope is absolutely fine and it looks really good. But if you've lost skin and soft tissue as well, then you need to bring in skin. And so generally speaking, there's two options. You either take skin from the back, where we call the latissimus dorsi muscle, which is the sort of largest muscle in the body, which helps with shoulder movement and arm movement. Or you can take tissue from your tummy. So tummy,
Oh, take from the tummy, please. I'll give you my tummy anytime. I take chance as well.
And if I had a ringgit for every time I heard that, I wouldn't need to do
You
plastic
wouldn't need to
surgery.
wouldn't need to go to your theater
No, I
anymore.
wouldn't. No, I wouldn't.
Okay, so if they take it from the stomach, yes.
Yeah, so we can transfer tissue from the tummy. And that, of course, gives you both skin and volume. Yeah. So
And the tummy will go down, right?
It's like a
and
two-in-one
you get-
The tummy
surgery.
will go down.
And you get a tummy
It's
tuck.
a tummy tuck.
Yeah, you get a tummy tuck.
You
for
get a
free.
tummy tuck.
Yeah, it's
Yeah.
two
How
in one.
great
It's
is
two in
that?
one. And this is where the few occasions where patient life can transform and change something negative to positive.
To positive.
Yeah. Similar to people with larger breasts, droopy, and sometimes we can just remove the cancer, reduce the size of the breast, and uplift them. So we have all these skills and techniques.
Okay, it's so
Yeah.
far it's all positives.
Yes.
Right.
I wouldn't mind a little bit of uplift.
Okay, now how do you tailor your recommendations to a patient's unique body type, lifestyle, and personal preferences, including like how big, how small, how perky, how, all of those considerations?
Yeah.
I think it's important to take all this into consideration when deciding what is the best reconstruction option if patients choose to have reconstruction and if it's suitable for reconstruction. We typically start with taking a detailed history and examination so that we can further understand patients' fitness for surgery and also whether they have certain lifestyle and hobbies.
Yeah, you're mentioning lifestyle and hobbies. So
Yes.
that's something which I was curious about. So what kind of lifestyle would you, or what kind of breasts would you recommend certain lifestyle? So let's say
Yeah.
me, for example, my lifestyle is I need to go on stage and most of my jokes on stage very risque, and I wear very revealing clothes. So let's just say I want reconstruction to ensure that my breasts are at an opportune level.
Yes. I think both myself and Ken would probably want to answer this question. So obviously, you've got a beautiful pair of breasts
Yes.
with excellent cleavage.
Yes.
And of course, that is what we want to try to achieve and give you back,
Mm-mm.
whether it's with your own tissue or with breast implant. I
Okay.
think you are somebody who probably would be suitable for both.
Mm-mm.
But obviously, it would involve a very detailed examination. Showing you before and after photos of some of these cases, going through the benefits,
Mm-mm.
the risks, the potential side effects and complications from both surgery, whether it's implant or autologous. So it's very important that we also allow you to have less downtime, or that you understand that how much downtime you need.
Oh, I
Yes.
can take.
Yeah, that you can
Do
take.
we need downtime?
Yes.
Yes.
Yeah. So I think again, it depends on the technique of reconstruction.
Okay.
So we touched a little bit about this earlier. Generally speaking, implant-based reconstruction, you recover much quicker.
Like 1 week, 2 weeks?
Yeah, about 1 to 2 weeks. I would say if you have to have autologous breast reconstruction, either from your back, from your tummy, then obviously you got to take into account that those areas need to heal too, right?
Okay.
And if you're moving tissue from somewhere else, the surgery is longer. So
I've heard of the cases where because the breast didn't heal properly. Okay, mind you, I mean, it has nothing to do with cancer or anything like that, but the breast was reconstructed, but it wasn't healed properly. And because the person is, how would I say, very active, and it bursts. Like
The implant burst, or
the implant burst or something like
the implant burst. That's actually very rare because
it has happened, but of course it's not me, but
Yes.
but yeah, I mean there was cases. So because you were saying that you need to take downtime as well, and if we are talking about lifestyle, I mean, perhaps she's in a more aggressive lifestyle.
Yeah.
So it's also
actually when we talk about lifestyle, it's a little bit slightly a different slant. So once you've fully recovered from your surgery, there shouldn't be any reason why you can't go back to the life that you had.
And how long will that take?
You're looking at around 4 to 6 weeks for sort of resuming normal activities.
Okay.
Right? And 6 months for the tissues to fully mature. But the point about lifestyle that I was talking about earlier was, let's say you are a golfer. You're
person.
a golfer, right?
Okay.
Or you do rock climbing, or perhaps you're a swimmer. Then the tissue that we remove from the back is not really suitable, because then you'll be losing some of that function of your shoulder, which doesn't allow you to go back to what you're doing.
Understand.
If you have a really slim lady, no tissue on the tummy whatsoever, then that option of taking tissue from the tummy isn't there anyway. So it's about looking at these kind of factors, and everyone is so individual. But I think what's important to understand is that there's so many options available that there's always an option that's suitable.
You mentioned risks and side effects and all these other things that might or could go wrong, because there's risks in every kind of surgery. Can you list those risks for us, for those of us considering reconstruction?
Yes. Of course, it's very specific, whether it's implant-based reconstruction or autologous-based reconstruction. So with implant-based, risks are usually rare. And in good hands, risk of complications should be as low as 3 to 5%. Ultimately, we would say there may be risk of wound infection, but we would cover it with antibiotics as a prevention. There may be risk of what we call capsular contracture. Our body is very clever. They will recognize, this implant doesn't belong to me. I'll form an envelope around it. And we grade it accordingly. So there will always be an envelope, but it's a question of whether over time it becomes very tight, because the body really recognizing, I don't want this. So it tends to look tight, and over time it may look a bit unnatural and a bit hardened. And patient needs to then understand, when this happens, we can still treat it in 5 to 10 years time, or maybe 20 years time, that we just have to release this pocket and put a new implant in.
I see.
Yes. There are, of course, very rare complications associated with breast implant, but nowadays, implant that is on the market are very safe. As for using own tissue, of course, you've got 2 places to heal, just not the breast, but you've got either your back or tummy.
Or your tummy as well.
Yeah, that means you need longer time to heal. You need to follow strict post-op recovery instruction, not to overwork and overstretch the wound, and resulting in delayed wound healing, infection, and even breakdown and losing the reconstruction. But these are very rare nowadays. It's a lot of understanding what happens during surgery and what patient needs to do after surgery to protect the reconstruction.
Because like it takes a longer while, like what you said. It
Yes.
depends on which type of reconstruction surgery they do decide. What about emotional challenges, especially during this downtime? We're talking about 4 weeks to 6 weeks,
Yes.
right? So will there be instances where the emotional state of mind of the patient is also at, I wouldn't say at risk, but also
At its weakest.
at its weakest and be taken into consideration?
Yes, of course. I mean, we talked about grief, right? So whether patient had reconstruction or no reconstruction, it's still losing part of you. It's that sense of loss again. You could still go through that stages of denial, bargaining, anger, acceptance, depression, and then accepting it again and reflecting, then hopefully recovery and survivorship. So we as medical professionals need to understand that it can come and go at any stage of the patient journey. So yes, the emotional aspect is very important. Again, education is important. Managing their expectation that sometimes it may look the same, but it might not feel the same.
Understand.
And this may affect their sexual fantasy, sexual satisfaction. And I've seen marriage breakdown.
Serious? Wow.
Yeah, with women losing their breasts and their relationships never the same. Not just from two people. The patient themselves don't see themselves as whole.
As a whole,
Yeah.
as a sexual being again.
Yeah, and then affect their relationship with their partner. So on some occasion, I would recommend them to see a counselor or even a psychologist. Yes.
Right.
Just to add a little bit to that, though, I think if you're looking at between immediate or delayed reconstruction, then actually it has been shown that immediate reconstruction there are positive psychological impact on the patient. Because if you think about it, if you are a lady who needs her breast removed, when you wake up from your surgery, you've got your reconstruction. You've got your breast still there, you know.
So it's
you
also
don't-
an option that they decide then there to take it out
Yes,
and then
yes.
get the reconstruction straight away. Well, that's amazing, actually.
You know, rather than
Yeah.
maybe a year down the line, you find you still got a flat chest with a scar across your chest, you know?
I mean, I'm a strong believer in get it right first time to
Yes.
avoid multiple surgeries in the near future or in the long-term future. I mean, Ken has a classic recent example of what a patient had gone through. Perhaps I'll let you share the story as well.
Yeah, this was quite recent. I mean, I only saw her a couple of weeks ago after her 6-week follow-up. But she was a breast cancer survivor. She had a mastectomy about 10 years ago.
Okay.
And while she healed well, she told me that she never really felt whole, you know. She's always felt that something was missing. She couldn't fit into clothes properly. She hadn't gone swimming for 10 years because she couldn't wear a swimsuit, right? So I undertook a breast reconstruction for her with tissue from her tummy. So she got a tummy tuck, right? And also reduced the other side of her breast because she was a bit older. The breast was heavy and droopy. So now she's got a pair of matching breasts. And she was tearful at her 6-week follow-up because she'd said, you know, doc, this underlines my journey through breast cancer. I've survived it for 10 years, but I never felt whole.
Yeah.
You know, and she was very grateful. And I was very touched by the whole thing. But I think that's why we work as doctors as well.
And I'm sure that gave her a little bit of confidence as well as empowerment. So it's not something to stay away from, you know. I would say faster, better, right?
Yeah. No, the next question is whether or not you are doing breast, surgery, augmentation because of cancer or because you just want to do it. How important is it to manage expectations, especially if you're an older patient?
Well, I think older or younger, I think expectations are so important, right? I mean, obviously, I'm a cosmetic surgeon as well. So the expectations from treatment that I provide is even higher than a reconstruction patient, for example. So it's really about information. It's really about being completely transparent and open with the patients, talking about the process of the surgery, talking about the recovery, talking about the risks and complications, right? So they understand what they're going through. And then looking at before and after photos, so that they understand that this is a potential outcome. And also showing them complications, right? Show them pictures of complications.
Yes.
Like this can also happen. Because ultimately, it's the patient's choice to go through surgery. And we as surgeons or doctors are there to support and help. So we don't force it on them.
Do you ever come across patients who say they're in their 50s or 60s and they want to look, they want 20-year-old breasts, and then it's
I'll be
done.
happy with just
And
25.
And then they have massive regrets. Has that ever happened? Or do you know of any cases where they've, because I think in your mindset, it's like, I'm a much older woman now, but I've got these boobs that are just so perky that it's kind of hard to suspend your disbelief
Really?
of the whole thing.
Women ask them that? Which women?
This one.
Yeah. Are your breasts 25-year-old chefs?
No.
Are you telling me something?
It's a scenario.
What's your
that
secret? What's your
I
secret?
don't know.
It's a scenario that I play in my head, these hypothetical situations. I mean,
I
is
think
there buyer's regret? I guess that's a question.
I think the psyche is very different between someone who deliberately going for breast enhancement or
Yes.
breast augmentation with breast implant versus someone who actually lost their breast and have a breast implant reconstruction. So I almost not seen women that regretted any form of reconstruction unless it just really doesn't suit them anymore.
Right.
But more often than not, I do see women who probably regretted their earlier age decision to have breast augmented with breast implant. So talking about ageism or non-ageism, I mean, my oldest breast mastectomy, the breast cancer patient that I've treated that had undergone mastectomy and breast implant reconstruction was 85.
Wow.
She was a ballroom dancer. She danced 5 days a week and do charity work in the weekend.
Okay.
And she came to clinic well-dressed with her heels. She told me, Dr. Mel, I do want reconstruction. And I was thinking, oh my God, you'd be one of the oldest patient that I would have reconstructed. But it's just so, it's just so humbling, but yet so satisfying to see an 85-year-old recover from surgery and able to continue wearing their ballroom dresses and carry on dancing.
Correct.
Yeah.
And the other extreme end is the under 40s with breast cancer, having to lose their breast and opted for breast reconstruction because often these patients are slim, thin, and maybe even sport enthusiasts. I have a few that are very active in social media. And I was so taken back when I saw a video of them, like a walk-in wardrobe with a rainbow color of matching gym outfit, bra and top. And this is someone who had bilateral mastectomy and breast implant reconstruction. So it's just amazing,
It gave them a new zeal of life.
Yes. Yes.
like breasts are very important for any woman, whether you like them slightly smaller or bigger. I mean, like what you say, lifestyle is lifestyle. Like I have friends who actually have, how would I say, like I would love my breasts to be bigger, but I have some friends who, like what you say, rock climbers and all that, who have bigger breasts and wants it to be resized, so, but breast does make a woman.
Yeah.
But just to answer your question directly, right, of whether I've seen patients who regretted surgery, I don't think that's the right word because, when your mindset when you're 20, when you're 30, when you're 40, and when you're 50 is very different.
Yes.
Your body is very different, right? You might be completely slim at 20 and say, I've got no breast whatsoever, I want implants. And then you've 3 kids and 20 years of marriage later, you've put on weight, the breasts have become saggy, right? Things have changed, and those implants may no longer suit you. So is it a regret? I wouldn't say it's a regret, but it's just that at that point in your life, you don't no longer need those breast implants. So that's the way I see it. You can take them out. Yeah.
Are there any specific post-surgery care tips that can help ensure the best possible outcome?
Yeah, that's a very good question. So I think I usually advise my patients to have a high protein diet during the recovery phase.
Oh, okay.
Because high protein is very important for tissue healing. I also advise them to take multivitamins because within multivitamins, you also have some trace minerals, which we know from research are quite important in wound healing. Probiotics is good to maintain your gut health, right? Because often you might be on antibiotics as well. So probiotics just balances out your normal gut flora. Sometimes patients might need physiotherapy. So if we're taking the muscle from the back, for example, we want the physios to work with the patient to regain that shoulder function as soon as possible. And post-surgical garments normally advised to wear for about 6 weeks. So let's say
Special bras. Yeah.
special bras, that's right, to support the tissues as they heal, or a girdle for following a tummy tuck if we take tissue from the tummy. So again, it depends on what we're doing.
On what they had to.
Yeah,
That's right.
I had to do a lot of oiling as well.
Yes,
Yes.
coconut.
Moisturizing.
Yes.
No, it was some special expensive oil from Africa.
Okay.
I can't even remember what it was, but
It's so difficult for patient to choose what's the right type of moisturizer, because I said your breast is going to be like your face. You need to have a routine after shower, moisturize, massage, and over the scar, better to also start using silicone ointment early to reduce bad scarring, because we Asians are prone to, Ken would know this a lot,
keloids. Is it?
keloid, hypertrophic. And recently I just referred a case to Ken as well. So he has all surgical, non-surgical, surgical options of how to treat bad keloid scarring actually. Yeah. So it's better to prevent. Prevention is better than cure. So yeah, early intervention is very important.
Kenneth, can you tell us a little bit more about the latest advancements in breast surgery, reconstruction surgery that we should all know about?
Yeah, I think in terms of surgical techniques, Dr. Mel has mentioned some of these techniques already, and that's actually a huge advancement in the way we manage breast cancer. But if you're looking at other things, in terms of innovations, I guess silicone implants are now in their 7th generation.
Wow.
We've had silicone implants for about 40 years, yeah?
Yes.
And when it first came out, it was a very thin shell, and it was filled with silicone liquid. But these days, we call them gummy bear implants. The silicone shell is very robust. In fact, the manufacturers will actually give you a lifetime warranty against rupture.
Wow.
So that's how confident they are with the shell, right? And the gummy bear implant, the implant itself, feels like a gummy bear inside, the consistency. So for instance, if the implant ruptures, you're not going to get silicone spread all over the breast. It just maintains its own form.
Okay, how would you know that if it leaks, or will there be signs?
So I think one of the earliest signs is a capsular contracture. Remember we talked about a capsule forming around the implant?
Yes.
So if a little bit of that silicone leaks out, it tends to irritate the tissues a bit more.
Okay.
So patients might get a firmer, harder capsule forming earlier.
Okay, so
you can actually feel it.
You'll be able to feel it.
So they can come to you and say, okay, I think it's leaked.
Or if they're worried, then actually just a very simple ultrasound or an MRI will show the implant shell, whether it's intact or whether it's...
I see. Okay, good.
Other techniques that we talk about, fat transfer is one of these advancements in the last 20 years, where we can harvest fat from a part of the body and use it to inject and fill areas that may be deficient.
So it's also fats from your body, which is like how you all did the tummy tuck for.
Or is it
the
liposuction fat?
It's liposuction fat. So
all these options. How can we go wrong?
Yeah, it's very popular for sort of facial rejuvenation, adding volume to the face, to the breast. Sometimes you use it for depressed scars. So when the scar becomes a bit depressed, we can put fat underneath
to just raise it.
To raise it up. That's right. Yeah.
Okay. How do you address potential risks that might come up or complications years after surgery?
Actually, depending on what type of reconstruction we do, if it's an autologous reconstruction, meaning we've taken it from your own body, the risks aren't very great for, the longevity of the reconstruction is good. It ages with you and ages, it's not many issues that can occur. I guess if you're having silicone implants, then generally speaking, most patients will require some form of replacement, maybe after 10 to 20 years, although that's not guaranteed. I have seen patients with implants in for over 20 years and they say, "Doc, change my implant for me." I say, "Well, what's wrong with it?" Nothing. So, well, leave it alone then,
Okay. Why do they want it changed though?
because they've been told that they will need it
Oh.
changed.
Yeah, it's like a myth. There's a myth that
okay,
implant
okay,
needs to
but
be
at least they go
changed.
back.
They
Get
come
it
back.
checked.
get
They come
checked.
back and
Yeah.
check,
Just
and
get
not
checked,
like
yeah.
get it done in some dodgy
Yeah.
clinic somewhere else.
Yeah.
I mean, with this liposuction technique in some part of the world where they have the luxury of going back for multiple surgeries, they just put an implant that is not fixed volume. It's what we call expander. So you can reduce and increase the size accordingly.
Wow.
So they'll take out some of the volume by remove some of the saline, because it's saline silicone, and then put fat, liposuct fat in.
Wow.
And then take more liposuct fat, put more in, and eventually they remove the whole implant. So there's some part of the world starting to do this combined technique.
Yeah.
But the downside is you do need to have multiple surgeries.
Yes.
Yes.
And kind of an inexhaustible bank account, right?
Yes, yes.
Not a
Right.
lot of, I guess, insurance covers this.
Yeah.
No.
It's cosmetic. Would this be considered a cosmetic procedure at this point, years later?
In
You know-
our community, we'll call it staged
Wow.
reconstruction.
Stage. Okay.
Staged reconstruction. So just takes a little bit longer with
Right.
multiple operations.
Okay.
No,
Understand.
but to answer your
Oh.
question, I think insurance companies aren't really privy to the fact that reconstruction is important for the lady, right? Because they see it as a cosmetic issue.
Yes.
I think
Yeah.
breast reconstruction actually contributes a lot to the psychology
Yes.
and the well-being of the patient.
Do you think insurance companies may,
Eventually.
eventually come to this agreement that we all have? That
It's
it should be
difficult.
covered.
Yeah.
It's difficult, right? As we were chatting a little bit about medical inflation. I think cost of healthcare is quite high.
Yeah.
So, well, we'll watch this space, I suppose.
Yeah.
Yeah.
I mean, there's hope because it's almost case to case
Case
now.
basis.
Because your case recently, the insurance cover her reconstruction, and that was amazing news for her
Mm.
after 10 years,
What advice would you give for someone who is feeling a little bit more overwhelmed, especially with their decision to undergo breast reconstruction?
Yeah, I think so many emotions that are going through. You come into the clinic, you get told you got breast cancer, you need a mastectomy or lumpectomy, and then next is like, hey, by the way, what reconstruction do you want? I think it's very overwhelming, and actually, it's important to give the patient space and time.
In this case, would you say close family or even friends would help in, kind of like maneuvering this period of time?
I think the most important thing is information and support. Without that information and support, you can't make a decision.
Correct.
More often than not, the human psyche is that we always think the worst, right? And you think, oh, if you don't know anything about reconstruction, I bet it's very complex. I bet it's, too much for me. I don't think I'll be able to take it. But then you've made those decisions based on your own assumptions, right?
Yeah.
So get the information you need
Correct.
first, I would say, and then decide for yourself.
And it's so important to highlight that immediate reconstruction has its benefit over delayed
Like what you say.
reconstruction. And, first of all, it's easier for the surgeon. Most of the time we can keep the skin and the nipple. And also you don't wake up with a flat chest. And I think financially it's also better because hopefully get everything done within one surgery. So it's important to really make them realize you do not have to rush into a decision, but please digest the information and come back with a decision that you will not feel like you've lost the chance of going through first time. And recently I was talking to my nurses as my clinic getting a little bit more busy. I was like, maybe I need to reduce the time I spend with my patient. And then my nurses went, tapi doctor, you cakap banyak. Okay lah, never mind. We leave it as half an hour to an hour. So, I realized that it is important.
It is
There's
important.
no shortcut.
Because,
Yeah.
and like what you say, information as well. They're already so overwhelmed when they find
Yes.
out that they have cancer. And it's like what you say, everything else, like after you say
Sometimes
the
it doesn't
C word,
absorb,
Yeah.
Yes.
You're having a conversation with your
Absolutely.
doctors and you're just so stunned
Yes.
as to information overload. So
Correct.
you need to
Yes.
digest and ask as many questions.
Yep.
Yeah.
Yep.
Yes.
Yeah, and
Yeah.
come back, right?
Yes.
Come back and think about it. You don't have to make a decision on the spot.
Yes.
So, what's the most rewarding thing in your work as a breast surgeon in helping women rebuild their lives post-cancer?
I think we both have something to say with that.
Yeah.
As for me, as a more breast cancer surgeon, I think I'm just in a very privileged position to be able to treat cancer, save lives, but also with the more advanced technique, I'm able to reduce physical disfigurement and hopefully give them back what they've lost with the pair of boobs that is acceptable to them. Yes.
Nice.
Kenneth?
I think I mirror what she said, but from a reconstruction point of view, it is really about giving that patient back what they have lost, right? And it's not about vanity. A lot of people think, oh, plastic surgeons is all about vanity, cosmetic surgery. No, actually, cosmetic surgery is only about 10% of what I actually do. I do a lot of reconstruction as well. And, giving that patient that breast back, giving them the confidence to go swimming, spend time with their children on the beach, wearing the clothes that they want to wear.
Feel whole.
Feel
again,
whole,
right?
most importantly.
I think it's so powerful.
If there's any one message that you could share with women facing breast reconstruction, what would it be, doctor?
That don't be afraid, right? Information is power. Don't make assumptions. Plastic surgeons have been doing reconstruction of the breast for 40 to 50 years.
Don't go in Google on your own.
It's not, these are not new techniques I'm talking about, These are techniques that have been tried and tested. So,
and there's always like new innovation, like what you say, that can help with even decreasing downtime and all.
Absolutely.
And have hope and believe that you're not alone.
That's
Any
most
queries, don't go Googling and stress yourself out and lose your sleep. Speak to professionals who have special interests in this field.
Support
Speak
groups.
to support groups. I mean, very fortunate in Malaysia, we have 3 big charity groups where we have survivors who've been through some of these procedures and they will be happily flashing their boobs and showing you how they look like after surgery as well.
I do that all the time.
Yes. Yeah. I mean, more importantly, also, I want to highlight that while surgery had advanced, but oncological treatment has also advanced with more targeted therapy. Therefore, we are, treating patients more with curative intent and potentially allowing patients to survive longer than before. We have now far more survivors than people dying from breast cancer, and we can save their breast. You don't have to lose your breast.
Yeah.
And
Wonderful. That's
with
good news.
that,
Thank you so much, Dr. Melissa, Dr. Kenneth, for joining us here on The Wow Show. May we all have our best breasts.